You've been focused on nursing homes for a long time. This isn't something that started this year, but working on something bipartisan with Senator Toomey, that's important right now. Can you talk about your efforts to protect not only residents in nursing and long-term care facilities, but also the employees, the people who work there and take care of them?
Yes, first of all, it's always a pleasure when you can work on a matter that is substantive and in need of change, but you can also do it in a bipartisan way. That doesn't happen often around here. So I'm grateful to work with Senator Toomey. Some of this nursing home work I've been doing off and on for the better part of 20 years now, more than 20, since my days as Auditor General. So even in those years, not enough change came on a national scale. And I think it's also important to point out that this is a matter that should be dealt with whether we had a pandemic or not. Some of these problems predated the pandemic, and some were made worse by the pandemic, but we're still analyzing that. As you know, more than 94,000 people have died in nursing homes across the country. When you add up the worker deaths and the resident deaths, and I should say nursing homes and all long-term care facilities, but most of them being nursing homes. So that number stares us in the face when it comes to dealing with COVID-19, the virus, the pandemic itself. But setting that aside just for a moment, this bill really is focused on improving care in nursing homes more broadly during a pandemic or after a pandemic. So we're focused kind of on basically two areas. One is to make sure that we hold nursing homes accountable and have tough enforcement, but also make sure that we help them improve their care, especially when they're part of what we would now call, when this is passed, the low-rated facility program as opposed to the special focus facility program.
When you look at nursing homes, what are some of the common missteps, mistakes, or shortcomings that you think could be addressed by a bill like this, or should be addressed moving forward into the future?
Well, sometimes it's basic care problems, infection control and other basic care issues that so many people focus on when it's their loved one, of course, and they come into the nursing home, which is not allowed now, but when under normal circumstances, and they see that the care hasn't been there. Now, sometimes the reason for that is neglect, and the home is just not doing a good job. But sometimes the nursing home tries very hard, but they don't have the staffing. If you have one staff member taking care of too many people, they can't get that attention that they deserve. So staffing is an issue that every nursing home runs into, not just having enough staff per resident, and those staffing ratios are really important, but also sometimes not being able to retain staff. The recruitment and retention of certified nurses, aides, and staff in nursing homes is very difficult, and the volatility is such that I've heard nursing homes over the years tell me they'll spend time over the course of a few weeks training 10 staff members, and within a few months, 7 or 8 of them are gone. They're down the street making more money doing something else. We had one nursing home in the Harrisburg area, just outside of the city of Harrisburg, gave a poignant example. They said, we're losing people to the Sheets down the street. Now, I love Sheets. I go there all the time when I'm on the road, but if we're paying those workers less on a national scale or on average than someone can make at Sheets, then we're going to have quality of care problems. But anyway, I think what we're trying to do here is to, on the oversight or accountability side, we're going to, by this law, require that no fewer than 3.5% of the lowest rated facilities participate in the program. That 3%, we call it 3.5, but 3% is roughly where it's been. 3% of all the 15,000 plus nursing homes in the country have problems. They're considered the lowest rated, and they're persistently low rated. We want to get them out of that, but we want to make sure that we're covering the whole universe of the 3%. Now we got a program that identifies 3%, but only focuses on a fraction of that, basically 88 or 90 out of 500 roughly. So we want to make sure that the entire universe of the 3 to 3, well, we're calling it 3.5%, is the subject of intensive review. So that's one thing, is make sure you can have the scope of the program wide enough. Number two, we want to establish by law on-site consultation and on-site educational programming for such facilities. We don't want to just say, you're doing a bad job, you're a low-rated facility, but you're on your own. The federal government should be working to help them, as should states. And we got to give them the resources to improve their care. We want to codify, put into law the core enforcement elements that are already part of the practice of oversight, but may not be codified in law. And then fourth, we want to reinvest the penalty dollars, the civil monetary penalty dollars, to bolster improvement among these program participants, so that the dollars of these monetary penalties are going back into improvement, so you can raise the level of care in those facilities. So that's on the stepped up enforcement and accountability side. We also want the program, or all these programs, to reflect that there are high rated programs and they should be recognized on the website.
Yeah, and I think another thing too, when you talk about some of the issues that exist, there is a funding element to that.
Yep.
It sounded like it does address it in some capacity. Is there a mechanism for which they can get assistance in that regard when you talk about assistance?
Yeah, we're going to have to, as we talk about passing the legislation itself, we're going to have to talk about appropriation levels, and that will be worked on over time. Sometimes in a bill like this, you have to focus on getting the policy right. The appropriations are a separate matter. Getting agreement ahead of time on appropriations is very difficult. So I wanted to make sure that we could get the policy right, and then make the case for the dollars appropriated.
Senator Casey, I know you're really well plugged in with Pennsylvania, and you have good conversations with the governor, and I'm sure at some point in time you've talked to the Secretary of Health, maybe not recently, but throughout the course of this pandemic. When you see what's happening in Pennsylvania with this fall resurgence, and you see that the communities really mirror what's happening in the nursing homes, I mean, really they're tied together. If there's a high incident rate in, say, a Franklin County, it's going to be the same at their nursing homes. How alarming do you find that to be?
Very alarming, and it's probably the best way to describe what I hear is 3 words: both need help. Meaning the state needs help dealing with the virus. That's why the state and local government support is important as part of a new relief bill. I think we need more Medicaid dollars to make sure that people can get healthcare coverage through Medicaid when they lose it because they lost their job in the pandemic. But also more broadly, part of our healthcare system, of course, is long-term care and nursing homes, and Medicaid funding is a big part of the fiscal or financial picture for a nursing home. So the nursing home challenges we have in some ways are a subset of the larger challenge of the pandemic, but they're very much aligned. So even as the country is struggling with the virus, with the case numbers setting records every day, both nationally and in Pennsylvania, and now unfortunately and tragically, the death number starting to accelerate all across the country. That same phenomenon is similar to what's been happening in nursing homes. The good news is we know exactly what to do to get all those numbers down, to get case numbers down overall and in nursing homes, and to get death numbers down. But it's back to the fundamentals. It's to use a football analogy, it's the blocking and tackling of the pandemic. Wear a mask, socially distance, make sure that on Thanksgiving you're not gathering with more than the number that the public health professionals tell you. Wash your hands, all these basics. And in the context of nursing homes, and I have a separate bill on this for the relief, as part of a relief bill. Nursing homes, in my judgment, need at least $20 billion. That's what my bill has. So they can have all the PPE they need, all of the testing that they need, and also if they have to retrofit the buildings or make changes in the building that cost money, to separate the nursing home resident or worker that has COVID-19 from those who don't. Just keeping people, literally the ultimate social distancing. And sometimes that costs money. If you have to build a separate wing or move people around, that can cost a lot of money. So we need to help nursing homes in the midst of the pandemic and not just point the finger at them.
Yeah, another thing, and I get two questions for you, but the stimulus, you talked about that, or at least, stepping in and providing assistance to every American. I just talked to Senator Toomey about it, and he said that, the economic recovery is underway, and he doesn't really see a need to provide maybe checks to independent families and individual Americans. What are your thoughts on a stimulus? I mean, do you think that discussion's still being had, or is it stalled?
I think we need a relief bill. I call it relief as opposed to stimulus, but most people call it stimulus, because I think it is relief, because a lot of these institutions, whether it's state and local government or whether it's our hospitals and health systems, whether it's a whole group of small businesses, but also, as you made reference to, to individuals who need help. If we're going to say to people, you might not want to be fully open in a restaurant, or we want you to do this, we want people to stay home. If you're going to do that, you have to make people whole to get them from here to there. Now, the only good news here is we know that there's now a bridge from here to a vaccine that we can actually see. It's not weeks, it's months. When we'll have a large scale, we hope, large scale deployment of the vaccine, meaning it's actually, the injections are going into people's arms and they're protected. So now that we can see that bridge, I really think the relief bill is that bridge from here to there. Get people through this period of time between now and having the vaccine widely available. And the problem we have now is if the Senate doesn't act, or if the Senate, figuratively speaking, isn't completely in the room negotiating, because now you have negotiations that have happened, not currently, but over time, for months now, between three people, and it should be four. It's Speaker Pelosi, Democratic Leader Schumer, and the White House, meaning Secretary Mnuchin, Secretary of Treasury, and sometimes the Chief of Staff. The fourth person or the fifth person, depending on who's in the room, has to be Mitch McConnell, because he's the majority leader of one of the two bodies of Congress, the Senate. So until he gets in the room to negotiate what I think should be a broad and robust relief bill, it should have food assistance, which we have not provided much of. It should have state and local government support, which alone will cost several $100 billion in my judgment. It should have help for Medicaid. It should have this nursing home element that I want. It should have small business help. All these elements don't add up to 100 or 200 or 300 billion. It's at least 1 trillion in my judgment, if not higher than that.
All right, last question. I know I've probably already taken too much of your time, but real quick, your thoughts on the election and the election process in Pennsylvania?
Well, as of last night, Joe, they're not finished counting. The Pennsylvania count is still underway, and counties are getting ready to certify. Some have, but Joe Biden's ahead by more than 82,000 votes. Most of the vote is counted now. It'll be certified on Monday. So that will end the discussion about Pennsylvania's vote. But the problem we have now is the president doesn't seem to be willing, A, to accept that, but B, and more importantly, to take action to have the kind of transition that you would expect in a peaceful transfer of power. And we're in the middle of a pandemic. We have the Biden team, the president-elect team has no time to waste. They've got to be briefed on everything the administration knows on the virus. They've got to have access to all that information about the vaccine and the distribution plan and how it's going to happen, because they're going to have to implement these plans for vaccine distribution and a strategy to control the virus. And all of that is essential. Take every step necessary to make sure the person coming after them has all the information that they need. And anything short of that anything short of full cooperation in a full and fair, peaceful transfer of power